Hello everyone, I'm Zhihan, a PhD candidate at the University of Hong Kong. Today I'm going to introduce our work, HealthPrism, a visual analytics system for exploring children's physical and mental health profiles with multimodal data. Children's physical and mental health correlate with their personal and family attributes. Relationships between these background characteristics and health outcomes have been widely studied by researchers in various domains. Such studies can provide insights into the underlying factors affecting children's health and aiding in the development of targeted interventions to improve their health outcomes. However, with the availability of multiple data sources such as context and motion data, we face challenges due to their large-scale, heterogeneous, and multimodal nature. Existing statistical hypothesis-based methods often rely on inflexible assumptions and incompatible with multimodal features, and the learning model-based approach have limited interpretability and require specialized technical expertise, which may be non-trivial for many researchers in public health and medical domains to explore. Visual analytics is a promising approach for researchers to understand multimodal data and children's health profiles from multiple levels. While most healthcare visual studies focus on analyzing electronic records, temporal events, healthcare dashboards, and only consider singular modalities, our study aims to develop an interactive visualization system for exploring children's health profiles with multimodal features from multiple levels. To this end, there are several critical challenges. The first is to effectively visualize the large volume of multimodal data. The second is to depict the correlations between varied inputs and health outcomes. It is also difficult to compare multimodal feature importance. Besides, supporting multi-level analysis and reasoning of multimodal data requires substantial effort. To address the challenge, we propose HealthPrism, an interactive visual analytics system to support researchers in associate domains to explore children's health profiles with multimodal features. It has three modules: data preprocessing, analysis, and visualization. After preprocessing, the motion and context pattern are input into a health profiling model to infer the six-dimensional health indicators and analyze the feature importance and influence. A front-end user interface with multiple coordinated views is built to support a comprehensive analysis. The data used in this paper are collected from more than 1,000 students in Hong Kong. The context feature collected includes physiological features recorded by researchers, such as age and sex. Besides, we also collected background information such as socioeconomic status and the electronic device usage patterns via questionnaires. As for the motion features, every participant was assigned a wristband with a thermometer and instructed to wear it except during bathing or showering. The mean wear duration is around 2 weeks. We also collected children's physical and mental health indicators for health profiling by widely used scales. Based on the scales, we derived 6 health indicators, describing children's health from the perspectives of physical activity intensity, physical functioning, psychosocial functioning, resilience, and connectedness. We interviewed 8 health data analytic experts and 3 visual design specialists to establish our system's design requirements. After iterative discussion, we identified 5 key requirements for efficient data presentation and effective data exploration from multiple levels. In data analysis module, we first inject context and motion features. After processing, each participant would obtain a context pattern vector, and motion features are averaged weekly for each axis, resulting in a triaxial weekly pattern for each participant. Then, the motion and the context patterns were input into a health profiling model. This model has 2 streams, starting from 2 gates. After going through the gates, the context and motion embeddings were concatenated together and used for inferring the health indicators. We then evaluate feature importance based on the gate mechanism. The gate with learnable parameters personalize input feature weights. For each participant, the intrinsic output of the gate is regarded as the personalized feature importance, and for context features, this importance aligns with each feature, while for motion features, It matches each axis in a minute. For context features, ranking was directly based on each feature's importance. For motion features, given that minute-based importance isn't insightful, we assess it over a customized time window. Triaxial motion importance was first integrated using root mean square, we then located subarray with the length of the customized window that has the highest sum to rank the importance of time slots. This allowed us to compare the importance of multimodal features. As for the feature influence analysis, we adopted a perturbation-based method. We directly changed the value of features and visualized the corresponding trends of 6 health indicators to see the influence. Then, an interactive visual analysis system was developed. It consists of 3 views: summary view, group view, and individual view. The summary view had 4 sections. The categorical feature summary utilizes a Sankey diagram for categorical flows. Heat map and a dynamic table are used to present the feature correlation. The top 10 most important features for each indicator are presented using stacked bars, and a slider is used to select the time window for motion feature importance. The motion feature summary displays the triaxial acceleration count and magnitude, guided by 2 sliders for time and range selection. The group view consists of 3 sections. The health profile distribution graph shows nodes for participants, categorized into 5 divisions, with links indicating health profile similarities. Users can toggle between graph and tabular views, search for participants by ID, and choose group or health indicators of interest. Participants are grouped by gender and age into 4 categories. In group context and motion feature summary, users can toggle between features and select the ones they are interested in. The individual view has 4 parts. In individual health profile, the shape of radar chart changes according to the health indicator selected in group view. And by clicking on the nodes in group view or inputting in the search box, a maximum of 2 individuals can be selected for direct comparison. The individual feature importance and influence analysis follows the same workflow as those in summary and group view. Both of the individual context and motion feature summary support direct comparison between 2 individuals. In individual context feature summary, different categories are shown in separated trees with values displayed as leaves. To demonstrate the effectiveness and usability of HealthPrism, we evaluate the system from the perspectives of model performance, case studies, and an expert interview. In model performance evaluation, we compare the proposed model with 2 interpretative baseline methods on different settings. We can see that the proposed model achieves the best performance under all settings. The ablation study confirms that the proposed model using both context and motion feature was optimal, especially with the gate mechanism, as it achieves the highest mean area under the curve. Moreover, our model has the fastest inference time. As for the case study, we invited the 8 experts who guided the design of the system to explore the HealthPrism freely. We summarized their observations and comments to form 2 cases to demonstrate HealthPrism. First is the feature importance and influence investigation from multiple levels. In overall level inspection, after exploring the overall feature importance, E7 found it was interesting that longer sleep duration on weekdays decreases the physical functioning and psychosocial functioning, but increases health confidence. And E2 found that children's physical functioning increased with family income and thought was in line with her knowledge. But children's connectedness decreased when family income increased, which gave her some new inspiration. In group level inspection, Yifang examined gender differences. She observed that females generally had poor physical functioning than males, while academic performance and interests were crucial for females. Exercise patterns mattered more for males. Females with higher academic performance often had a lower physical functioning, while males with higher proportion of family members with exercise habits displayed better physical health. Yifang speculated that cultural biases might lead parents to encourage more activity in boys. She suggested the need for balance between academics and physical activity, especially for girls. In individual level inspection, E3 inspected the feature importance and influence of two individuals and found that learning mode had different influence on them. After looking into their context and motion features, she found these two individuals have very different characteristics. She saw since the learning mode would influence many other factors, it was reasonable that the learning mode has different influence on very different children. Another case compared health profiles between different groups. E8 examined health profiles across groups and noticed that while females' resilience grew with their interest in Chinese, it decreased with better performance in the subject. He checked the correlation heat map in group view and found that, unlike English and mathematics, there was a weaker correlation between interest and performance in Chinese. This aligns with the common sense that Chinese is a course difficult to obtain high score even if you are interested in it and pay great effort. He thought the reason for the positive influence of interest in Chinese on resilience might be that those interested in Chinese usually tend to have more extracurricular readings, so they can learn from how the characters in books overcome challenges and obstacles, which is an excellent way to develop resilience. By comparing the acceleration magnitude, he also found that female children have lower acceleration than males almost across the whole week pattern, which made him draw a similar conclusion with E1 that parents and teachers should encourage female children to do more physical activities. In expert interview, we interviewed two experts who guided the design of the system and four new experts who had never used the system before the interview. They were asked to conduct task-driven exploration and free exploration. We summarized their feedback from the perspectives of system workflow, visualization and interaction, and suggestion. Their feedback further demonstrates the usability and effectiveness of our system. To summarize, our major contributions include an interactive visual analytics system to support researchers in associate domain to explore children's health profile with multimodal features effectively and efficiently, a multimodal learning model for feature importance assessment and influence analysis. The model can support analyzing multimodal feature importance and influence from multiple levels. Quantitative model performance evaluation, case study, and expert interview demonstrate the effectiveness and usability of HealthPrism. In the future, the system can be further improved by enhancing customization, decreasing learning costs, incorporating more modalities of data, supporting direct identification and comparison of cohorts, and gathering requirements from general public to adapt HealthPrism for wider use. That's the end of my presentation. You can scan the QR code to access the paper. Also, I'm currently looking for collaborators in mobile analytics system to work together. For more information, you can visit my personal websites or contact me via email. Thank you very much for your attention.